How are you doing today, Jessica?
I'm great. Spring break. The weather's beautiful. I can't complain right now.
So, man, I swear, man, and I apologize for all the people listening because it's just me in the beginning complaining about the weather. I just checked and it says Friday night or like Saturday morning.
Snow.
Yeah, which sucks because I think some people already know. So, me and my wife, we sell food sometimes, especially the flower farm. That's been fun. This Saturday, we're going to go to the brewery, and this time we're going to sell elotes or corn, Mexican style.
Right.
Apparently, we picked like the day where it's going to be cold and it's on spring break, so we don't even know what's going to happen. But it's fine. It's more like since it's like a new item, like a test run.
Right.
But I was just like, because Myra picked we have a few dates either in March or in April. And I told her, I was like, I didn't want to do them because I don't know what the weather looks like.
It's so tough in spring. You just never know. I mean, we had snow a week ago.
Yeah.
I mean, it's so tough, especially in the Midwest.
Yeah.
It's tough to know what's going to happen.
Man, like when we came back from the Dominican Republic, it was like 2 weeks ago. Yeah, we came back on the 14th on Valentine's Day. We came back. I swear, I thought I was going to die because so we came from Santo Domingo to Atlanta and Atlanta to Omaha. And then, I'm falling asleep and it's like, I think it's like almost midnight or something. And I wake up and I was like, is that rain? And I'm like, no, that's snow. But it was like a snowstorm. It was pouring
it was bad.
It was bad. And
right.
then I'm like, oh, great. Because first of all, I didn't bring my jacket. I left it in the van in the parking lot in Omaha. But when we got there, everything's fine. It's not snowing. So it's cold, but it's not like chilling cold. I'm like, okay. So we get in there and we're carpooling. And then it took like it was like a 3-hour drive. I'm going in and out of like sleep. And we were arriving like Sioux City. I cannot see anything. Like I'm looking, I can't see. There's a snowstorm. Luckily, Elijah and Greg are the best people at driving in the snow. But we get here, I'm like, oh snap, it just snowed. And then like the next few days or following week, it feels amazing.
Right.
So
that's the Midwest for you.
Man,
it really is.
It is tough.
Crazy.
Yeah, but I'll deal with it. I'm waiting for the summer. I love the summer. So.
I do too. And I don't have to work in the summer. I have the summers off. So
you have the summers off?
I do have the summers off. And I also have spring break.
What?
Yeah.
Oh, snap. Well, we'll go into it a little bit. So what do you do?
I teach at the university. I'm a professor and I teach in the nursing department.
Now, is that what you always wanted to be since you were a little kid or nursing or how did that happen?
I always wanted to be a teacher. Both my parents are teachers. And so I always wanted to be a teacher. And then when I got to college, things changed and I weirdly found my way into the medical field through the military. And then I went to nursing school and then I realized you can be a nurse and teach. So that's how I got into being a professor and nurse educator.
So you were in the military also?
Yes.
What branch?
I was in the Army.
Oh, snap. Wow.
Yep.
How did that happen?
After high school, I tried college. I wasn't ready for it. So I thought, okay, I need to figure out something to do. So I joined the military and I was in the Army National Guard down in Nebraska for 9 years.
How was it?
Yeah. It was good. I got deployed once. And then after 9 years, I had to make that decision. Do I want to stay in? Do I want to get out? Because I had to like sign a new contract. And I was like, well, I was graduating from nursing school. I decided to get out. But they paid for my school. I got to see a lot of the world, honestly. It was, some bad experiences, but the people were awesome and I learned a lot. But that's what got me into the medical field. So I became a medic in the military. And then I decided to become a nurse after my training.
And then what, is there I talked to someone that was also a nurse, but how does that work? Like what would a normal day be like? Because I know nurses do. So this is now I know how it works. I always thought when I was younger, doctors did everything. I mean, they probably do some stuff. I thought they did like everything, but now nurses do a lot of stuff, and actually they are the backbone of
Nurses
everything.
are at the bedside 24 hours a day.
Yeah.
Unlike the doctors. So if you watch Grey's Anatomy,
yeah,
you cannot believe Grey's Anatomy.
So it's not true.
No, not
okay.
at all. The nurses are the ones who are getting the patients out of bed. They're the ones who draw labs or the phlebotomists. It's not, Grey's Anatomy is not real, like real hospital setting. It's the nurses are doing all this stuff. They're at the bedside 24 hours a day, every day.
There it is. 2 years ago, me and Myra, we were watching, for some reason, Grey's Anatomy for the first time on Netflix. And I was like, whoa, they do a lot. They're going this and this and that. And then I heard from like other doctors or med students, they're like, I don't think that's how it is. I'm like, really?
It's not.
Yeah. And then, then I got Google and YouTube and I found out, oh, snap, the nurses do a bunch of stuff.
Yes, we do.
So without y'all guys, it would kind of be tumbling down a bit, right?
Right. We are the eyes and ears for the doctors.
So why would you have rather been a doctor or a nurse?
Nurse.
Nurse? How come?
Or
what do you like about it?
What I like about being a nurse?
Yeah.
I like learning about the body. I like putting those different pieces together with the diagnosis and the labs and the physical assessment and figuring out what's going on with the patient. And that's when I teach. I talk to my students a lot about, okay, let's take all these pieces and we're kind of like detectives when we put them together to really figure out what's going on with the patient and what we need to do, what things we need to ask for with the doctors, different interventions that might be beneficial for them. So it's, again, taking all this different data and putting it together and really seeing the bigger picture of what's going on with this patient. And it's a multitude of different things that come together. It's not just a physical assessment. It's other things maybe outside of what's going on with them. But sometimes it's a mystery too, and trying to figure out what's going on. And then working with the physicians, the providers, respiratory therapy, physical therapy, occupational therapy, dietitians. It's all of us coming together to help the patient get back to baseline or as close as they can before they came in the hospital to get that quality of life, like the best quality of life they can have once they're out of the hospital, and to keep them out of the hospital.
Okay, so it's not like, same thing with the patient. It's not like one person does the whole job. It's like you're saying, like kind of like a team effort.
Right, it's interdisciplinary. So we have lots of people coming together, and we really push that in the nursing department and all of the medical fields. Like, we have to work together as a team because we can't be siloed. We have to work together as a team to get the patient, to meet those outcomes, to get them back home or wherever we need to get them to recover or recuperate or to get better. So we have to work together.
Okay. So just like how doctors have like different specialties, is it the same thing with nursing? Or are they mostly just all around?
We're all trained the same way. And then once you graduate, that's where you can determine where you want to go. So maybe you want to work at the ICU, you might have some extra training. So intensive care, you might have to get certain other qualifications. If you work in the NICU with the babies, you have to have maybe other special, but it just depends on where you work, of what you need, but you can really go anywhere and work. So, but then if you become an advanced practitioner, like a nurse practitioner, then you would go maybe be a family nurse practitioner, maybe a pediatric, gerontology. That's where you go on and get more like a specialty.
Okay. Oh, now I remember. So it was, I think the one right before this episode, whenever this is aired, I was talking to, they called me up. That a new Vermillion dermatology?
I saw it.
Yeah. So Emma, she's one of the PAs. We were just talking about that, like how, because I don't know if it happened before back in the day. Usually it was just the doctors, but now, like, for example, PAs, they could kind of be like the family doctor, but you also the nurse practitioners stuff.
Right. It depends on what state you're in. So nurse practitioners can practice independently without a doctor, and a PA, usually has to have a doctor above them, but it depends on what state you're in and what, the laws are and what they can actually do. So any advanced practitioner or provider can be a doctor, and they can be an MD, they can be a doctor of osteopathy, which is a little different, but they do a lot of the same things. Nurse practitioner, PA, be a midwife, deliver babies. So those are all advanced practitioners.
What's up, y'all? If y'all want to be a guest or a sponsor, please shoot me an email at vermillionunplugged@gmail.com.
Okay. So how would you, all right, I'm going to start all over because this is all brand new. Because actually, funny thing was when I graduated college, so me, I should have knew, but I just didn't know. I was like, okay, I don't know what to do. And someone mentioned about, I don't know how I contacted them from back home in Texas. They say you should probably go into the nursing program. And I was contacting, I guess, the counselors or whoever.
Mhm.
And they say, hey, it looks like your grades and whatever you took, you qualify for it. I was like, oh, snap. But then I heard it was like another whatever years. I'm like, oh man, actually, it didn't even take me 4 years. It took me like 5.5 because I don't know, scheduling issues. But I was like, I can't do more school. But it always caught my eye a little bit with that, the medical field stuff. I wish I advanced more. But like, let's say like I'm brand new. I'm out of school. I want to go back to school, let's say. And I'm like, you know what? The nursing seems cool. Is there like different routes you have to go? Because I saw that, I don't. You correct me. You
Okay.
You know more. I seen like there's like a 2-year thing, or there's a master's thing, or there's a specialty, or if I want to become a practitioner, like how does it start, and where would you go from that?
You could take several routes. So you can get an associate's, which is a 2-year program. At the end, though, you take your NCLEX, which is the test to say, yes, you can be a nurse. And that's after you're done with school. So that gives you your registered nurse, your RN. You can do a 4-year program and get your bachelor's of science in nursing. But at the end of that, you also still have to take your NCLEX, which will make you an RN. You can also graduate with some, I'm not 100% sure because I haven't worked in a program that has an accelerated program, where it's usually like a year or 18 months. And that's usually after you have a bachelor's. And then you decide, oh, now I want to go do an accelerated program. So it's like usually again a year to 18 months and you do all of your nursing stuff. And then you graduate, then you take your NCLEX, you pass it, and then you can work as a nurse.
Mm.
Then if you go on to be an advanced practitioner, to be a nurse practitioner or anything else, you still have to have those 4 years. So you have to have a bachelor's in order to go into that. And usually there's a master's. A lot of times they have a doctor in nursing, a nurse practitioner. I got my master's in nurse education. And then I went on and got my doctorate in an educational doctorate in nursing education.
Oh, so you have that.
So I'm a doctor nurse.
Oh, so you're a doctor. So
Right.
it's Dr. Jessica, but you're a nurse.
Yeah.
That is
Yep.
kind of trippy.
Yeah.
So is there a reason why? So why did you go all the way for that stuff?
In order to teach, so whenever you teach, you have to always have a degree above the level you're teaching. So if you're teaching in the bachelor's, you have to have a master's in order to teach.
Mm.
And if you want to teach master's or doctorate, you have to have that degree, which having a doctorate is a terminal degree. You can't get anything higher than a doctorate. So where I worked when I was teaching, because of how we're accredited, the people that say, yes, you can be at nursing school, they wanted us to have a certain percent of our faculty had to have a doctorate. And so when I got hired, it was a stipulation of in the next 2 years, you will be in a doctorate program. Mm-hmm. And so that's why I went on, because it was a part of where I worked and it was I had to do it. And then I did it. And then, I people say, oh, you had a doctorate. If I can do it, I think anybody can get their doctorate.
Uh-huh.
I'm not that smart.
No, I see all of y'all. So this is, I'm telling, and Myra hates it. Myra hates it when I say this. I say like so I view like everyone, like all the way up here, and I'm like down here. I'm just a guy working like administration at the med school. I don't do nothing.
I really think if I can get a master's, I struggled through nursing school. My bachelor's, I struggled. I really struggled. I probably didn't push myself to my full ability and capability. I struggled. And I'll tell my students all the time, I failed a nursing class when I was in nursing school. And at the time it was devastating. Because then you have to start with a new class. You can't, progress. And I tell my students, if they're in that situation, right now it feels like this mountain that you have to get over. But when you look back, you'll be better for it. It'll be this little speed bump in life. Mm. In the grand scheme of things, it'll just be this little speed bump. And so I like to tell them that, just to kind of let them know, that doesn't mean you're not going to be successful if you fail, right? Life happens, things happen, you learn from it, and you'll get past it. And then you look back and say, okay, that was probably one of the best things that's happened is I had to repeat this course because, maybe something was going on in my life or I really wasn't understanding. And so that would help me out in the future by taking this class again. So, but I did. I struggled in nursing school.
How different, like if, all right, someone that's or that wants to be a nurse, how different is the education, or I don't want to say the education, the class environment versus like the real world? Like once you're in the job, is it that different? Is it similar? I've heard that I guess it depends on the whatever career you have.
Right. So it depends on where you're at. But our students also go to clinical.
Oh,
right.
Okay.
So they have classroom time.
Cool.
So the class I teach, it's 2-hour class periods a week. But then on top of that, they go to simulation where they work with mannequins, and that's a place where you can make mistakes. No one's going to get hurt. No one's going to die. This is where we learn. And we have the time it's more intentional, so we can make things happen on purpose, unlike with real patients. We can't do that. So they do simulation, they go into lab and they practice skills in lab. And then they also go to clinical and they go to the different hospitals up in Sioux Falls. So they get to do that and then be with nurses and do stuff with real patients. And it's going to be a little bit different, right? Because it depends on what facility you work at. We can teach them certain things, but a lot of it depends on what facility they're at, and they might do it a little different than the way we do it. But we also have a curriculum that we have to abide by too. So we have to stick with that curriculum, and what the books tell us, what the evidence-based stuff tells us, and we kind of have to go by that.
Oh, okay.
But I wouldn't say it's a ton different. But once you get, you have then your own autonomy, but you also have to go back to what you learned. And the number one goal is the patient's safety with being a nurse. I mean, that's your number one goal, as long as they're safe.
Okay. No, that's cool then. I didn't know about the clinical. I heard about, the med students, yeah, they do clinicals.
Right.
But no, that actually makes sense because, man, maybe I should have been a nurse now.
You can still go back. We have students who, it's like a second career. We have students who their kids are in college. Mm-hmm. So it's never too late to go back to school.
Because this is what I wanted to do. Well, when I found out. So, okay, at first I didn't know what I wanted to be. And then I was thinking, because I think when I started, I went to community college first. And I was like, what should I do? I was like thinking, what do I like? And I think I wanted to do, it's called
kinesiology.
Yeah, something like that. Because I really liked, same thing, it was about the body. It was really cool. I like that stuff. Right. And then I heard something about being a physical therapist. Mm-hmm. But then I just heard it's like 8 years or something, like 4 and 4 technically. I was like, and I didn't know. And I was like, okay, what else can I do? I'm like, well, what's similar? Well, I got to pick a degree, biology. Apparently, I didn't know it was just so general, especially the classes I was taking. Right. Then you got like, some are like, for example, the medical stuff, which I really like. Some are like animal based. Some are, I guess, geology based. And I'm like, oh, I guess that's technically the science and all that. I don't know why. And then right when I graduated, because I took some of the labs and I liked that stuff. Mm-hmm. And then I looked up what I wanted to do. I wanted to be one of those, what do they call it? Is it medical technologist or the people that run
like biomedical science?
Stuff like that, but the ones that are in the hospital, like, hey, you send the testing and this and that, and they're handling
lab?
All the lab stuff.
Yeah.
I wanted to do something like that. And I worked it sucked because I graduated during COVID.
Oh,
but
sure.
I got a job at this diagnostic testing, whatever. Mm-hmm. It was cool, but, I started with the base and to work on the machines and all this, all that cool. I thought it was cool. You have to get that degree or work there. And then for some reason, I only worked there 2 weeks. They cut my hours. So that's why I came over here. Anyways, I found a job at the med school. His name is XJ Wong's in his lab. And it was amazing. It was the cool stuff. Like I do like the experiments, the mouse heart surgeries. That stuff is insane.
Do they do that at Lee Med?
Yeah.
I've never, so I don't get to go on that side of the building.
Yeah.
It's locked. So I don't get to see the other side of the building, right? I'm on 3rd floor. So I have no idea what happens on that side.
Oh, this stuff is cool.
Never been over there. I see people walk in.
Yeah. And the labs are cool. It doesn't look like industrial. So it looks like still like I want to say in a nice way. It looks like like a lab like you take in
Right.
high school, but with so much stuff. And these professors are smart. Like I didn't know I was gonna be doing. So like when I started, they have almost all of them use mice,
Okay.
and they got different genes. And then one of the first things I had to do was you take a sample of actually when they're pups, you got to clip their little toes,
Okay.
and then you digest in whatever chemicals, and then you got to this whole little thing where you find their genotype. It's really, I think it's cool.
Interesting.
It's really really cool. And then one of the things I didn't know is they make almost everything. Like the chemicals, you could buy some of this stuff,
Right.
but I guess the good thing about being a professor and you're working on grants, it's like money. So they show you how to do everything. Like you make your own chemical. I'm like, oh snap! So
I had no idea what happens over there.
yeah.
So that's interesting.
That stuff is cool. And then on the basement, that's where I was mostly at with the animal, the ARC. Man, they're amazing people. But like you have all these different type of mice, and they'll do like some of the stuff with. Do you know Jessica Freeling?
No.
Oh snap! She's gone, but she was the one that like helped run anything with mice equipment. It's badass. They show like they would show us how to do like the echocardiograms on mice, and then also some of like the heart surgeries and another type of surgery. And then we focus on hearts. Other ones do cancers. Other ones do neuro. Other ones do Dr. Lee Ball. He doesn't do. I don't think he does anything with animals. He does stuff with humans. And I was one of the test subjects. I volunteered, and he puts like this little. I don't know, whatever, because he
like
works
electrode caps.
Yeah, stuff with the brain. So that, man, all that stuff is cool. And these, like, I know there's a bunch of PhD students. A lot of them are international. One of them, I think he's in Dr. Chen's lab. Dr. Chen is, man, I think he's working on like heart regeneration with something. But I think one of his students is from China. But I think if I remember right, because China has a different when they go to school. So he's technically a surgeon, but he has to get a PhD to become a real doctor. So he already knows this stuff. I'm like,
right.
So all this stuff.
It's weird how that translates from different countries to here and vice versa.
Yeah.
I think it's I don't understand it, but I don't have to because that's not my job.
Yeah. But man, that stuff I love that stuff. That stuff was kind of cool. And then one of the things I was thinking about before, but I'm like, no, not anymore. Becoming a PhD student. I was like, okay, that seems cool. I like the research stuff. Until I found out it's not just 4 years. It's like 4, 5, 6 years, 7 years. And
it depends on how long your research takes too.
Yeah.
So that's what it depends on. Because mine was 4 years, but I have an EDD, which is an educational doctorate. So mine was more, so I did research and I did a qualitative study. So I did interviews. So I did interviews with students. My dissertation was in a short and condensed version of the title, lived experience of students who are veterans of the military and experienced a traumatic event, and kind of how that affected like them going through nursing school. So I did interviews, and then I collected, and then I put all the data together and figured out, or kind of categorized it into like, what are some issues that are keeping them from being successful? What are ones that, what are things that they need for support? But it was really interesting because in the middle of nursing school, I got deployed.
Oh,
and so
really?
when I came, right. So I was gone for 3 semesters. So I got deployed in the middle of the nursing school, and I came back, and it was still very new with people getting deployed and being in school because I'm the National Guard, right? So I was civilian most of the time. And there was really no support for people who were in the military and got deployed. And this was back in 2004. So there wasn't really a lot of like, what do they need? How can we support them? And so I struggled. And I think that was another reason why I struggled through nursing school, because I have PTSD from my experience over there. So I had like flashbacks. I had things when I was in nursing school, like in the lab doing things that I would go back to being a medic when I was over in Iraq. But there's really not a lot of support. Mm-hmm. So I wanted to see if other people now, and this was 5 years ago when I did my research of, are people still struggling with this? And now there's Student Veterans of America, and it's a national organization, and it's so they have a lot more support. So now it's a national organization that I don't think started until like maybe 2008, and so that wasn't anywhere close to being there when I came back. And I know a lot of my fellow soldiers also had a lot of troubles kind of coming back and reintegrating into civilian life, not being full-time military because we're a National Guard.
Yeah. It's funny that you mentioned that. I had Kevin Brady on, and he was in the military too. I forgot what branch. I want to say he said Army, but he was also a medic. And we were talking about in the episode just a little bit the PTSD, because he said he's also seen some stuff. And I think, well, I guess now there's more awareness to it, but back then there wasn't. And then funny thing is, so since Myra, if you want to know, Myra's from Mexico, so she's learning. She likes the history. She's looking at like history, like World War II, and she's also looking at the wars that happened, after 9/11. Right. And one of the movies we just saw a month ago. Are you familiar with the movie called American Sniper?
I am. I haven't seen it though.
Yeah, there's it's not a spoiler. It's been out since forever. But yeah, he's I think his name's Chris Kyle. He was he was a sniper, and he a lot of stuff, but it shows the aspect of him being there, and it's not like Call of Duty. It's nothing like that. Right. It's actually like, it's bad. It's war. It's really bad. And it shows him like in war he's doing this, but when coming back to civilian life, before he gets deployed, I guess I don't know how many times he got deployed, but how tough it is adjusting, and also like same thing, the PTSD and all that other stuff. It's one of the things I'm like, oh snap, like this stuff is nuts. And I don't think I have family members in the military, so I don't know too much about it. But when I talk to people that are veterans, I'm like, man, you guys are better than I am.
And I think it's really tough though to talk about it too, because if like you lose a leg, people can see like, hey, I see you have a disability. But when it's something mental like PTSD, a lot of people don't understand it because you can't physically see it. And so it's kind of like people don't talk about it as much. It's just mental health in general. Yeah. Right. People don't talk about, if I have high blood pressure, I'm going to take a pill. Right. There's no shame in that because you have high blood pressure. But if people have mental health, there's a stigma. You don't talk about it. You don't tell people about it. But why? I think mental health is just as important as your physical health.
Are they like nowadays? Man, I guess I should talk to, Brock Boss?
Yep.
Yeah, I had him on, and he's great because he's in my community group, and we talk a little bit about that stuff. And I think I don't want to go too much into it, but he was talking about there's like another new position that hopefully he could get, but it could be a little dangerous. And I always wonder, like nowadays, I wonder how people can handle that. I don't know the resources nowadays because everything's changed, and for the better, because now like awareness, the PTSD, all that stuff, but especially with younger guys. I don't know. Hopefully, we never go into like another real war in this and that, because that stuff. Right. I don't know that stuff. I don't know. I cannot imagine it at all, and I can't. Like I don't know. You guys experienced something else, especially when Kevin was talking about it. Like you kind of feel like, man, this stuff is insane. Like.
And it's hard because you can't just like talk to like anybody about it because they're not going to understand. So, again, I think if you're in like full-time military, you have those people around you all the time who have experienced the same thing you experienced. But when you're National Guard, you come home, you all go your separate ways into your different lives because, you go do your 1 weekend a month, your 2 weeks every year of training. And so you're not always around those people who you relied on for a whole year while you're deployed, who witnessed the same things you did. And so sometimes you will seclude yourself or you'll, get bad habits that are not healthy. And then you're not always going to have somebody maybe checking up on you like you would. Now, I'm not saying people who are active duty are getting better healthcare or better awareness than people maybe National Guard or Reserve, but there might be around it more often. But there are VAs all over, and you just have to learn how to navigate. So I go to the VA for my mental health stuff, and they have been amazing. But you also have to be your own advocate. They're not going to come seek you out.
Yeah.
You have to go to them. But once you do, then whatever you need, they'll work with you. But you have to, again, seek them out and be your own advocate.
Okay. No, that's good. So what do you do to like relax? One thing Jessica Skelton told me, she said you're a runner.
I am a runner.
Yeah. And I either yesterday or the day before, I saw you running. Past the university. I was like, hey, is that Jessica?
It was probably me. Was I wearing a hat?
Yeah.
I was wearing a hat. Yeah.
Okay.
Yep.
So
if my students see me, I'll be like, that wasn't me. Did I look like I was dying? Nope, wasn't me.
When did you start running?
I ran my whole life.
Really? You're a runner? Okay.
I ran my whole life. My brother and I, growing up, he's also still a runner. My dad, I think, maybe I'm in kindergarten, first grade. My brother is 4 years older, so maybe fourth grade. He dropped us off at a park and like, hey, they're having cross country practice. Go run. And that's how it started.
And that's it?
That's it.
Wow.
I've been running ever since.
Are you familiar with Carly Hurd?
I need to meet her. I found out we have people in common through the ultra running community.
Yeah.
I've never met her.
Okay.
I need to meet her.
Yeah.
I've never met her though.
Because that's when we started. Because apparently I thought we were just going to talk about because she's the associate dean. I thought we were talking about the business school, but we don't think we were just talking about running.
Yeah.
So, but you say ultra. So how far do you run?
So I've done 4 50Ks. I've done, I haven't signed up yet, but there's a 48-hour run down in Nebraska, end of April. I haven't signed up yet, but I want to sign it up for it. And then I'm going to do, I signed up for 100K in August in Wisconsin. What else do I have? I'm also going out. So Western States is like out in California. It's like the one that everybody wants to run. And it's a 100-miler. Now, I will never go run that, but you can do their training camp. So it's 3 days and it's out by like Lake Tahoe and it's gorgeous. I've never been, but it's 3 days and like each day you do a segment of the trail. So I'm going to go do that over Memorial Day weekend with a couple of my running friends.
How do you guys run? Man, so this is...
Jose, let's be honest. We don't run the whole time.
Okay, you sure? Because I
don't run the whole time.
Who did I talk to? It was... she goes to church. I just forgot who it was now. It was... Who else runs? I know Randy's like insane. I know Randy.
Right.
He runs like a...
Chris Smith.
Uh-huh.
No.
Not,
Mike Smith.
Mike Smith.
He did a 50K with me.
Who?
In Newton Hills.
What about, is it Kim?
Kim Olsen.
Yeah, she
runs.
She told us, if I remember right, she ran like the longest one or something. She ran like 6 or 8 hours or something like that.
Right. Yeah.
I'm like 6-8 hours. I'm dying like running 40 minutes.
We don't run the whole time. My 50Ks, I don't run the whole time.
Okay, so it's not like 6 hours every day, nothing like that.
No.
Okay.
You walk a little bit, or they like to call it power hiking, not walking.
Okay.
Because power hiking sounds better than walking.
Okay. One time, I remember this, and I will not lie about it. It was just it was insane. So back in college, it was, for whose class? It was I took an organic chemistry class, and one of the
that sounds awful.
It was horrible. It sucked. That's why I'm not a chemist. But one of the extra credits was I guess the little college, they were doing not a marathon, a 5K.
5K?
5K. And he said, hey, if you guys go, I'll give you extra credit. So apparently all of us went.
Yeah.
And I heard he said that he used to do power walking. He would talk about it. I forgot his name. Was it Luis? He was Puerto Rican. And so what they had was they had a 5K. It was around, they had like this little lake and you go around it. The other side, they were doing 10K. Well, I'm like, I'll just do the 5K. I'm not going to do that. So we start and, he does, I swear, this is how, I've seen it, how they just walk, but like
people power walk. And so when I was in college, my freshman year of college, I ran track and cross country. And one of our meets, it's an Olympic sport. like power walking is.
Yeah.
It's ridiculous. They can run faster. They can power walk faster for a 5K, 3K than I can run.
That's what
It's ridiculous how fast they go.
That's where I was going with it.
Crazy.
So
crazy.
It was, we started, and I'm a decent, I guess, I'm better like short distance, but I'm a decent, okay runner. And so I'm there, and I think it's like, I'm going to say like a third. We're at that third. I see him, and he's walking, like power walking. And he's like, hey, what's going on? Are you okay? I'm like, yeah. And he just zooms. I swear, I cannot lie about this. And then I'm jogging, and I'm like, well, let me go at it. And like, I'm like right behind him, and I can't keep up.
Fast.
Yeah. But I'm
so
like,
fast.
But then like, I'm trying to almost kind of sprint. Either I'm the slowest guy, but I'm not. But this guy is just walking fast.
Yeah.
So I could not believe it until I saw videos on YouTube how they do it.
And there's a rule too. You always have to have 1 foot on the ground.
Yeah.
You always have to have 1 foot on the ground. That's the rule, because that's the difference between walking and running.
Ah, that's why.
And they like judges that watch.
Okay.
So, but I don't power hike,
Power hike.
which is just walking.
Okay.
It's not power walking
What about?
because you're slowing down.
Okay. I don't know. Y'all run. I used to kind of run before, and then I got into, I'm all over the place. I started up doing powerlifting, and now I'm just doing the regular weights. And I'm going to say the fall, with some people at Resilient Church. It was with Jake, Mason, and a few of them. They invited me to run.
Mm-hmm.
Okay, let's run. So we started close where Prentice Park is to the winery.
Okay.
And then back. It would equal like 4 miles exactly. And I didn't know that. So I was dying. And then I would go, we would do it like every Tuesday or sometimes twice a week. And man, dude, I don't know. They do it all the time. So I'm like always the last guy. And sometimes it's me and Jake. Because Jake's all like, thanks for staying with me. I'm like, no, I'm probably just so tired. But I just cannot keep up with them. But now I still can't keep up. But now I got it. I could run only 4 miles without getting tired.
If you can run 4 miles, you can do a 10K.
Do you think so?
If you can do a 10K, you can do a half. If you can do a half, you can run a marathon.
Really? So
I guarantee you could.
Okay, I talked with, Luke Hayes?
I know who he is, but I don't know him.
So he's also a runner, and
Right.
I would talk with him about it. So I was just saying, man, I cannot keep up with these guys. And he says, hey, just try not to just focus on you. Yeah.
Yep.
And that's when I started, okay, let me start small. And I guess the problem was I was trying to keep up with it, and I'm just get so tired. But they run marathons and all that. So I'm like, okay, let me just work on it. And yeah, it's all.
I think that's what running's about. Running's about being comfortable with yourself. So a lot of people listen to music. I don't listen to music when I run.
Really?
Because what happens is I tend to then start, my cadence is to the beat of the music. And that might be maybe too fast for me.
Ooh.
So I listen to podcasts. I listen to running podcasts.
Uh-huh.
Now I'm going to listen to Vermillion Unplugged. And because it's just like having a conversation with a friend and you're just listening. And so then you just kind of listen to your body and how your body feels. So if I slow down, I slow down. If I speed up, I speed up. But I'm not going at the cadence of the music, because that will throw me off. Again, I might be pushing myself too fast, or I might be going too slow, but I just need to listen to your body.
You know what? Now that I'm thinking about it, because I used to listen to music, but then I started downloading like the videos on Netflix and just started like hearing that, or same thing on YouTube. And I think it does feel a little bit different. But also sometimes I'm a little competitive. So that's why I'm like, I don't want to be last. But then I just got to accept if I'm running.
Again, competing against yourself too. I mean, so with ultras, like, I know I'm not going to win. Like, that's not why I'm going. My kids are like, oh, did you get first place? And I always say I got first place for my name, my age, and my hometown. I always get first place for that. But it's almost about like competing against yourself. Because it is an individual sport, but it is better to run with people. It's more fun, let's be honest, to run with people. But you don't always have to keep up. So we moved here almost 4 years ago from Lincoln, and I had a really good group of friends that we would run with, and we would only run as fast as the slowest person. It wasn't about how fast we ran. It was more about time on our feet and being together. So I think that has a lot to do with it. So you don't always have to keep up with everyone. Sometimes they'll move. I'm like, I don't care if it takes me 20 minutes, to run this. It's still time on your feet. And a mile is a mile, whether it's a 6-minute mile or a 15-minute mile, it's still a mile. You're still going the same distance.
Okay. See, all right, I'll take that advice.
Okay.
What do you think about running on a treadmill?
I hate it.
So Myra,
Hate it.
I love my wife a lot, but I do talk about her. So Myra's actually into running now, but she will run on the treadmill. She will not run outside with me. Well, it's cold, but she will not run outside with me. And I cannot run on the treadmill. I don't know. I just feel bored. I don't know. I feel like it's not the same.
I get bored. I hate it. It feels to me, it feels different. I call it the dreadmill. I hate the treadmill. I would rather put on 20 layers of clothes and run outside any day than run on a treadmill.
What's the coldest you've ran?
In the negatives.
Okay.
Oh yeah.
I've ran same thing. And it's so weird because I'm the guy complaining about the weather all the time. But this winter, because I was like, no, I need to keep running. And I started running in the cold and also in the negative. Same thing. I'm like, layer it up. And it sucks the first, 10, 15 minutes.
You honestly, so the rule is you dress not for your first mile, you dress for your second mile. Because your first mile, your body's going to warm up real fast. Like the gloves might come off. You might have to take a layer off. So you don't dress for your first mile. That's kind of like the rule. Mm-hmm. So because again, you get hot real quick. So the first mile is going to suck because your body's warming up. So you just kind of have to suck through that. Yeah. And then you'll warm up.
Yep. That's how it is. Because then I would also run with, same thing. Like I got a ski mask.
Yep.
But like throughout, like we were saying, after that second mile or after that first mile, I got to kind of take it off. If I don't, it starts freezing.
Right.
I don't know if it's the condensation. It's freezing. Like there's icicles coming out and I start getting a little hot.
Warm.
Yeah. Same thing with the gloves. I would run with like snow gloves and they start, getting off.
Your hands are sweaty.
Yeah. And it sucks because then when I take it off, the cold air just kind of freezes. So I got to either lighten it up a little bit with some just, regular gloves. But first mile does suck.
The first mile when it's cold.
So is there are you going to run the Boston Marathon or one of the longest?
Never. I've done 2 marathons. The first one was I just wanted to, I've done multiple half marathons and I love them because I can just go and no pressure. And so I set a goal for myself one year and I was like, okay, before I turn 40, I want to do a full marathon. And I lived right outside of Lincoln. And Lincoln, there's a huge marathon in Lincoln. So I trained for it. I did it. And then that was in the spring. And then I did Des Moines in the fall. And I thought, okay, I'm done with marathons. I feel like there's a lot of pressure that you have to run the whole time. And then through my brother, I found ultra running. And it's a completely different world than road racing. So like trail running, ultras, they're completely different than the road racing community. Mm-hmm. Anytime you meet somebody, a lot of times it's, how fast is your marathon? What's your time? What's your time for when you get to ultra running, nobody cares what your time is. It's very laid back. It's just a different vibe than when it comes to road racing.
I think that's where I got to figure out the difference. Cause I know some people when we're running, they're like, what's y'all's, what's that called? A minute per mile or something like that. And then I have a little watch and I track it and I'm trying to be like, no, I need to get faster, but it's just, I guess there's no point.
And it's time on your feet, honestly.
Yeah.
Like I try not need to look. So I have my watch and I try to keep it on like just the time. And so I don't even see what my pace is. I was like, I'll go out for, I don't know, just how I feel. Like I don't ever go out for like a specific mileage. I'm just like, I feel okay. Well, I got 3 miles. Okay, I'll stop. Or I feel good. I'll keep going. Maybe I'll get 5 miles today. So it just depends.
Okay, because I want to go. So I guess now I'm like, okay, I should not focus on the time. I want to go the distance. I'm just so impressed by people that run like long distance. I don't know. I'm like, that seems insane, and I want to do it.
I don't want to say it's fun because when you're doing it, it sucks. But it's like the compliment thinking like, oh my gosh, I just ran 31 miles. Mm-hmm. Like that's crazy to say that you've done that. And there's people who, run 100 miles. There's races that are 250 miles. You know, one of my friends multiple times has done, it's called Badwater 135. It's 135 miles and you start in Death Valley and go to Mount Whitney.
Death Valley in
California. That's where you start. And then you end up in Mount Whitney. So I think that's like 8. I don't know what even the elevation gain is, but it's crazy.
Man, especially at church, there's just so many people that run. Same thing when they talk about Randy, how I need to get Randy on.
You do. I just saw they were walking yesterday when I was running and I was like, Jose needs to get Randy on there. I think that he'd be good.
He talked about one time, because we were like a little...
and he's fast too.
Yeah, he's fast.
His half marathons, he's like running like 6-minute miles.
Because I think he was like either now or back then, he was like a pro.
He was fast. Because Mariah Schaefer, they went and did a half marathon together. I think he beat her.
Yeah.
And she's like in her 20s.
No,
and she was a collegiate runner too.
He's fast. I think he's fast. I think he was like a pro or something because he also did something called Ironmans or
probably.
Yeah, and
that scares me.
Yeah,
I can swim and bike, but not very far.
He also talked about it, and then other people talked about it. I forgot. I don't know which one he was doing, but he was having a heart attack.
Yeah.
Yeah. And then he still keeps doing it. I'm like, oh snap, that's
I think
awesome.
he said, I talked to him about it. I think he said half marathon is the farthest he'll go because of what happened. So.
And then he's still running in town. Like, if people will see him. Like, you guys correct. If it's the guy running.
I think he's is he a morning runner?
I see him all over. I think most of the mornings.
I am not a morning runner. I'm an afternoon runner. And I've heard you get up really early.
Yeah. I get up at, when I go to the gym, we get up at 5. But when I run, it's like around 6:30. And I don't even know why. Same thing. I complain about the cold. I should be running in the afternoons.
So I'll go run after this.
Oh, you will? Okay.
Yeah. Because I'm not.
And it's a beautiful day too.
It is gorgeous.
Yeah.
It's supposed to be in the high 70s.
Yeah.
Yeah.
And then, Saturday's going to be like that next week.
Right.
It should be nice, but apparently there might be snow on. I don't know. It's insane.
It is.
So you've been here 4 years?
It'll be 4 years in August.
So how did you get to Hillside?
So weird story. So my son was in the same class. When we moved here, he was in the same class as Robbie's daughter, youngest daughter.
Yeah.
And there's some Christmas thing that we, in the classroom, we went together and Liam was wearing a Nebraska hat. And so Brenna said, Dad, they are from Nebraska too. And I had not met her. I had not. So we started talking and actually we found out that we actually grew up in Fremont together. His dad and my dad taught together for many years in Fremont High School. So my dad remembered his dad and everything. And so that kind of got that connection. And then our neighbors across the street are the Heckerleys.
Oh, they are?
Yep.
Oh, so you guys, okay.
Yeah, we literally live across the street from them.
Uh-huh.
Yep. And they go there. And so we kind of some roundabout way, and then we started going there, and I love it.
Uh-huh.
I love Hillside.
Man, I honestly actually do enjoy it. And same thing. People want to know I complain all the time. That's just me. And I remember when we got here, I think I already told the story. So we got here in September 2020, COVID stuff, but I think everything started opening up the following year, and that's summer of 2021. I think like in the summer they do, what's it called? Like kids have free lunch or something like that.
Right. Yeah.
Yeah. So, but Myra wasn't working yet. So she would take Victoria and she met Heidi DeVries.
Okay.
And they started talking, but Myra didn't know too much English yet, but they just started talking. And that's how it was. And then one time we went to the pool, and that's the first time I met Heidi. And I think we just agreed on having lunch together at our house.
Mm-hmm.
So they came, which was we were actually kind of late at our house. So I was like, whoops. But they were talking with the neighbors. And our neighbors right across from us is the Mollenkamps.
Oh,
so
okay.
They all went together. Yeah. And we ate, and I think they invited us to church. And man, I just had bad experience with church, and I was like, I don't want to go. I don't want to go to Hillside. I grew up Catholic, and then I Googled it.
I did too.
There you go. See? First of all, I thought everyone was Catholic, but then I found out all these other denominations, and it said something about CMA evangelical, and I was like, aren't those crazy people that are going to tell me I'm going to die and burn in hell? But we went and it was completely different than the Catholic church that I went to, especially I would go in Spanish. And it was nice. And we started going every week. And then same thing, putting Victoria, she went Awana, and now I went to that missions trip, whatever. So that's weird. It's not a sponsor. I mean, if Hillside wants to, if Robbie wants to give me some money, I'm down for a sponsor.
And you've had him and Jim on.
Yeah.
And Noah.
Yeah.
So, I mean,
hopefully I get whenever this aired. I had Robbie on it was in February 28th. It takes me a while to upload this stuff. But, so he was my first episode.
Mm-hmm.
So, and then, the first one aired like around February 29th, technically. So I was like, let's do a round 2.
Nice.
Since I had my anniversary.
Yeah.
But this one we talked about that, mostly the Dominican Republic trip.
Mhm.
Man, that stuff was, I cannot just, were you there on that,
I saw it when you guys spoke.
yeah.
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 I was there.
I was so scared. That was I think one of the scariest things going up there. Did you go the first or second service?
Second.
So I don't know if you remember, but I said, whoa, there's a lot of people. I was not supposed to say that. That was supposed to be in my mind.
There's a big difference between 9 and 10:45, though.
Yeah.
There's always more people at 10:45.
Yeah. And then like the day before, it was Saturday, we practiced, but it was just us. It was just practicing.
Right.
And I was like, I got this. And the morning came and I saw a lot of people. I was like, but I got through it. And I don't know. I felt like something had to change it up. And then when I saw those people, I was like, man, dude, this is insane. But no, it was great. I have people asking me about that trip. Man, that trip was.
It's like you guys did a lot of good work.
Yeah, I don't know what hit me, because honestly, I talked about it before. I hear about mission trips, but I had the I don't know, maybe it's just bad impression. I was like, that seems like a waste of time. Why would I go help people?
Mm-hmm.
But something caught my eye on it, especially when Stacia and Kristen were talking about it. And like I mentioned a little bit, it just caught my eye for some reason. But then they said, hey, we need people with skills. And I was like, oh, I got no skills, so I can't do it. But they say, hey, as long as you can follow directions. And then I went to the meeting and they talked about the price. I was like, there's no way I'm going to do it. And I told Myra about it. I thought she was going to say no. And she says, let's all go. I was like,
That's awesome.
I was like, dang it, man. Well, how are we going to do it? And I asked a few people, like, how do you guys get or donation or funding, stuff like
Right.
that? And what they would tell me is they just ask.
Mhm.
And I'm like, I don't like asking for money. So we just had that idea. Hey, let's do like a little fundraiser. Let's make some tacos or make some tamales. And we all got together. So
I'm still upset we didn't get any.
you didn't get any? Did you get tacos or any tamales or not?
We got the tacos that day.
But not the tamales?
They were gone by the time 10:45 came around. They were all gone.
So we actually, all of us made more money on the tamales, which surprised me. It surprised all of us. If we would have known, because we thought they were going to be gone. We thought no one was going to buy. Well, I thought, my bad. I thought there was going to be a lot of people in the first service and we were going to sell all of them a second service.
They were gone. There was I think maybe 2 bags left.
Yeah.
At 10:45, and they were called for. Like as soon as Robbie or Jim said that, they were called for. So we didn't get any.
Oh man, that sucked. And we made a lot.
They went fast.
Yeah, we made over 100. Did we make over 100 something? Yeah. So, well, I'm gonna get you some tamales when tamales season hits.
I love tamales.
Yeah, man, those tamales are really good.
Yeah.
I'm not bragging about my wife, but she makes some good tamales.
I have no doubt.
Yeah. You haven't tried them yet?
No.
Really?
No.
Man.
We had the tacos when we had it after church,
Yeah.
but no, they were gone.
No. We might. Do you know when they do that annual meeting every year at Hillside?
Is it April? I'm not sure when they do it.
April or May.
Okay.
Robbie asked us if we could make tacos again.
Perfect.
So I'm like, yeah, we're down.
That sounds perfect.
Or should we just make the tamales instead?
I don't know. They're a lot of work.
They are a lot of work.
Yeah.
But it's actually, well, it is, and it's because now me and Myra have been making it for a few years. So
You guys have a good system down?
yeah, it's a
I'm sure.
system. It's just, we got it going.
Yep.
With these tamales. The cool thing is, technically, technically we didn't make them. It was actually them that made it, like our group,
Mhm.
which is cool because we're
Yeah.
showing them. And even though some of them, it's not all perfect, it's kind of cool because, hey, like, y'all guys made it. So hopefully they turned out good. I didn't. Did I get to taste one?
Oh, I didn't taste it.
I'm so sorry. I'll get. Now I feel bad.
There's a lot of. Even my husband's like, I was gonna get some.
Yeah.
They're not. What?
Myra, she wanted me to ask you this about your husband Jay.
Yes.
She said, "Hey, ask Jessica if he is like if he has like Viking lineage because it's the hair. It's just
and the beard.
It's just majestic.
I don't think he does.
Okay,
I don't think so. I have to ask him, but I don't think there is. I bet he honestly like loves those shows though.
Okay,
like he loves those Viking shows. I'll have to. He'll get a hoot out of that. No, I don't think he does have any.
Okay, I was gonna say, does he have like a dragon or anything like that?
Yeah, that's funny.
So a few weeks ago, it was a Wednesday.
He did Awana.
Yeah. It was. Did he tell you about it?
No.
Oh, so
no, but I know he did security for Awana and for a youth group on a Wednesday night.
Yeah, so it was okay. Then it was a youth group because Awana's only every 2 weeks.
Right.
It's because we were there. We were talking with Robbie about something, and Victoria, she was in like the nursing thing, and then she was supposed to be practicing her spelling words, and then once we were over,
he did tell me about this.
Yeah,
he told me about he was practicing spelling with her.
Yeah, apparently Victoria was asking him for
He did tell me.
And I was like, what are you doing?
He was like, she had it too. I remember the story.
Yeah, so
he's like, she was ready to go. She knew those words.
Yeah, I was like, man, he's supposed to be doing security and now he's helping with spelling words.
Oh.
So
he said she was ready. He said she knew all of them.
And she was. I think she got a perfect score. So
good. I will tell him.
Well, so now
I'll let him know.
So to repay you guys, now I gotta get you guys tamales.
I mean, I'm not gonna say no.
So
I won't say no. I promise.
All right. So look, we've been at it at 58 minutes.
Oh my gosh.
Doesn't
even seem like it.
I know, right? But
wow.
I'm gonna have to end it. But is there any last words, any shout outs you want to give?
I don't know. This was fun though.
Yeah.
I was nervous.
Really? Everyone's nervous.
I know, but it's just, it does not seem like it's been almost an hour.
Yeah. See,
at all.
Mostly, actually, I'm actually more nervous. People might not know that. Actually, funny thing is, what's that word called? Introvert?
Introvert?
Yeah. Technically, I'd rather just be inside my house playing video games with everything locked up.
Yeah.
So that's why during COVID, when people were like, oh man, what's going to happen? For me,
you're like perfect.
It's like a normal day. I've head to school.
I don't have to go anywhere. I don't have to see anybody.
Especially, like I have to go to school. I'll do my thing online and I think I'll still playing Fortnite. So yeah, surprisingly that. And because Myra's actually surprised. She's like, you're an introvert? I'm like, yeah.
So I'm an extroverted introvert. Mm-hmm. So I mean, like I can be around people, but then I'm fine being at home too.
Yeah. So I have no problem. Maybe that's me. Because I could talk to people.
Mm-hmm.
I just gotta same thing, figure out the rhythm. Because I don't know, maybe I just got better at it. Because before, I just didn't know how to talk to people.
Mm-hmm.
And you know what helped me out? When I worked part-time at Best Buy during college, because I had to
interact with people.
Yeah, and it was the first job I had to like talk to people. I'm not gonna lie, the first few weeks were kind of rough. Like, I remember there was a lady. I do remember there was a lady asking because I was working the computer section. She was asking about stuff, and I just said, "This is what I said." She said, "What's the difference between these two?" And I was like, "This one's more powerful." She's like, "What's powerful?" And I'm like, "I don't know." And I just walked out, and I remember seeing her. She was like, "What?" And then someone from appliances had to come and kind of explain some of the stuff. So I was.
Yeah, I'm not. I did maybe like high school. Like I worked at like a shoe store. I'm not good at sales. Mm-hmm. Like just having to like convince people to buy things. But then I worked at a gas station. When people would come up and I could do that. But if I have to like purposely, that sounds bad, not purposely interact with people, but try to convince them. And when you were talking about at church, getting up in front of people. So I can teach in front of 60 students, no problem. But if I had to go up and do that and talk in front of people doing speeches like that, I can't do that.
Really?
But I can teach in front of 60, 80 students, no problem. So I don't know what the difference is, but if I have to go up and present in front of people, I hate doing that.
Wow. So I was at the it was the week after February 14th when we came back.
Mhm.
So it's because I got invited to do a presentation at the Rotary Club,
Okay.
and it was about the podcast. And I was thinking, I was like, what am I going to talk about? And I was like, well, I'll just talk about all my guests. And apparently, like, because I was looking through some of them, and well, it's like, this is how I think of y'all, like, so super professional, everything, you guys got your PowerPoints and notes. And I was like, well, I don't know how to do that. How do I do that? And I was like, you know what? I'm just going to be myself. And I had nothing prepared. So I just put a bunch of stuff. And when I went up, I was like, man, dude, I was so scared. But I was like, okay.
That's how I would be too.
Yeah, I was like, well, I'll just talk about myself. That's it. So maybe, I wonder if Best Buy helped me. Because
kind of force you to get out of your shell a little bit.
yeah, one thing, because they said, are you comfortable selling credit cards? And I was like, no, but I got the job. But honestly, like, maybe, and I think Best Buy has changed a bit, but for me, I try to be like super open and honest as I can, which actually, I think that helped me a lot, because actually I was pretty good at the sales, but I would not lie. Like when they, especially so, I'm getting way off track, but in the summer, it's the kind of back to school sales and all that. And we have a lot of discounts. A lot of students with parents come, and they're looking for a computer.
Right.
And now I know about computers and tech. A lot of our guys, not a lot of them, it's not their fault. They would sell them the high end, especially MacBooks that they don't need.
Right. They just need something to be able to write papers, do their,
First thing I just ask, I say, what are you going to do? And they're like, well, first, a lot of them will just go into community college and they don't know what they're doing. And they're looking at these computers, and I say, hey, I'm going to show you. Well, I'm not going to show you the high end. I'll just show you what you actually need. So I'll be very honest, and they'll tell me, what's the difference? I'm like, this does this. And especially like high end stuff. A lot of people that are trying to go into engineering, they'll give me the specs. And first of all, they'll go to a MacBook. And I'm like, actually, the MacBook is not going to help you out at all. Even though it's super expensive for some reason, for what you're going to be doing, it won't even run the program.
Yeah.
And then I'll show them something else that's actually cheaper and will benefit. So I try to be super honest. And one thing that I kind of got in trouble, and it's actually my fault. So the big thing at Best Buy back then was selling the Microsoft Office.
Oh, right.
So they had two different things. They had one that was a subscription, which technically it's cheaper up front, but it's a subscription. And I would tell them, I'm like, yeah, but it's every single month. The other one was just you pay and it's yours.
Right.
But it's like super expensive. It was like $150. Okay, 130 with the discount. But this is where I got in trouble. I would say, where school are you going to? They're like the community college around Fort Worth.
Most of them have students, don't they? Have Microsoft for students.
Yeah, just like here. So I would say, hey, you get that for free.
Yeah.
Or if you don't have it, just use Google Docs.
Yeah.
And I got in trouble for that. They say, hey, what are you doing? I'm like, well, I'm being honest. They're like, hey, well, quit it because we got to sell stuff. It's like, my bad.
Yeah, I have a hard time with that too.
Yeah. So I just try to be honest. And then a funny thing also, this is actually, so if you go to Best Buy, and this is actually a little tip, and it actually works. And, it's actually their fault. So you'll hear when they kind of pressure you for, oh, do you want the protection plan?
Right. Yes,
it actually works because it depends on the item, and I'll tell you why. For example, on a computer, there's a 1 year, 2 year, 3 year protection plan. It's called GSP. So, and what they sell will cover if it breaks, anything breaks, you could put a shotgun to it and they'll cover it. And it can. That's what one of my guys would say, and it does. So a trick you can do is, let's say you just get the 1 year. Let's say it's like $150. You're like, $150. The computer though costs like $700, $800.
Right.
What you can do is go to Geek Squad and just say, hey, it doesn't work. And I think they'll check everything. But if you keep doing it, or just the easiest way is like, I got the protection plan. Can I get the credit? And they'll give you that credit, which you paid for the laptop.
Wow.
And then same thing, you just go with another thing. And it's super simple. That's what I kind of do, or I did. And then an easier thing is there's another thing called GSPR, which means replacement. If you get it on headphones, watches, more like
Nice.
accessories.
Yeah.
All you have to do is say, hey, it doesn't work. And they'll just give you that credit back. And then you get another item. That's how you kind of do your little upgrades.
Yeah. Nice.
Yeah. Same thing. The
Nice.
tricky thing is with TVs. I don't know what they'll tell. Because I'm a super honest guy. I still remember this stuff. With TVs, if they give you a protection plan, it will not cover if the TV, like if it breaks, like a crack.
Right.
Which I'm like, what's the point then? But it just covers if it fails. But same thing. With this one's a little more tricky because I had it on my TV. The screen just did not turn on for some reason, so they had to send in a tech. And if the tech cannot fix it, they'll just give you that credit back. So like and I had a super strange situation. So if you go to Best Buy, if you go to like the LG section, it's an OLEDs. They're the super, you'll see them. It's like super, super nice screens. Those TVs are like, years ago, it was like $2,000. A friend of mine because we had discounts, but if you were the LG representative, I don't know how they do it now. They probably changed because of me, but they had this 50 to 75% discount on TVs, on LG TVs. It was insane. So he got a TV, and the following year, he gets another discount. He asked me if I wanted to buy it. I was like, how much? He said $1,000. I was like, nah, I'll do like 400. He was like, nah, give me like 600. I said, look, I'll give you $500 and I'll throw in, I collect video game systems. I had an extra old Nintendo entertainment system. I said, I'll throw that in. He was like, okay, deal. And it came with that protection plan. So everything was fine until my screen started glitching up for some reason. And then it failed. And I was like, but he told me, he's like, hey, I got the protection plan. Just give me the name and this and that. So the tech came and he couldn't fix it. Well, he's like, well, we'll give you whatever the credit was, but it was a weird system because it was an employee thing. So what I got, the credit was like, it was like $1,500. So
way more than what you paid for it.
Yeah.
Right.
So I got the new model, technically free with the new thing. I still got that TV.
Nice.
The only thing is the protection plan kind of expired, I think 2 years ago. And I was like, oh, dang it. But yeah, if you head to Best Buy, get the protection plan.
Okay. It's worth it.
Apple products those are completely different. They, I don't know. Apple is just so weird. They make great products. I think it's just, I look at value. So I'm like, it's because like on computer, I know what I'm getting. So I think it's not worth it for me, just for me. But the Apple Care, you have to take that stuff to the Apple store. I know they say Best Buy could do it. They are a repair place, but just take it to the Apple store. That's just me. But those are my Best Buy tips.
Best Buy tips. And I only have a iPhone. That's the only thing I have Apple. Now, the other people in my family, in my household, they have other stuff, but I don't have an Apple Watch or anything. I don't.
Yeah. So if you are looking for like tech stuff, head to Best Buy, get the protection plan. Don't tell them I said that. But yeah, it's just easy. That's what we've been doing with our watches, headphones.
Do you use it? So what do you use when you run? You told me.
I have a Galaxy Watch.
Okay.
Yeah, that's what I use.
Oh, okay.
I heard
are you an Android user then?
Yeah, Carly said that she uses a Fitbit.
Okay. I have a Garmin.
Yeah, they say Garmin and Fitbits are really great. So
yeah.
I know a little, even though I'm not like into the running, I know the tech stuff.
Yep.
But they say Fitbit's the top one. Garmin's are the best ones also. Especially if it's running exercise stuff, they're amazing.
Yeah.
The one I got, I don't even use it that much. I just have it because I got a discount on it. They're really good. The Samsung Health Tracker is fine. But if you're looking for more like smart watch, like notifications, calling, those are fine. I think all of them are fine.
See, mine does. I don't get text on mine. I can't. There's no speaker or anything, so I have. It'll tell me somebody's calling, but that's about it.
Do you remember what kind of Garmin it is?
I think it's a 265.
Okay, yeah.
I gotta look at it.
Do you remember how much it was?
It's a 265S. Oh.
Was it over the 300 or 400?
Yeah.
It doesn't have the calling or texting?
I can't text on it. I can't even see when somebody texts. Now, other things like when my Ring camera goes off, it goes off.
Just notification,
when somebody calls, right. like through my calendar. But yeah, and then it tells me somebody's calling, but I can't
okay.
like I have to get my phone, and it doesn't go through the text.
Oh, I should check on that. Because I was looking for a watch for Myra. I got her for, what was it? Not Valentine's Day. I don't know. Man, what was it? I forgot when. I got her a Fitbit.
Mm-hmm.
I think it was a Fitbit Versa.
Garmin has kids ones.
Yeah. And
Yeah.
then Myra didn't, she thought it was too expensive. And then, because she still had her watch. And funny thing is, I don't know what happened. I took it back and her watch died.
Oh.
And I'm like, well, now I got to get you a watch. But same thing. She liked she wanted something to health tracking, but she
Mhm.
also wanted the calling and this and that. So
Right.
we had to decide with the Galaxy watch.
Yeah.
Yeah. But
Our kids both of our kids have Apple Watches now. They don't have phones.
Mhm.
They won't get phones.
mine either.
But they had the gizmos,
Oh yeah.
which is like, I mean, it's just like one down, but so they can call, they can text, but we had control
Mhm.
over who they can call and who they can text. So it wasn't just anybody.
Oh.
So we had an app, and then we would put like, okay, grandma, grandpa, dad, whoever, and we had to actually allow them. Now anybody could call them if they had the number, but they couldn't call anybody unless we controlled it.
So we're looking for something for Victoria. Well, Myra is. I think it's fine if they don't have one, but Myra's looking. She saw something about that watch. She says she wants Victoria to have something just in case, but we don't want to give her a phone. She's like in fourth grade. Like I don't want to give her a phone.
Right.
I had a phone.
I have a 7th grader who still doesn't have a phone.
Yeah,
I hear about it every day.
I had a phone when I was 8th grade, so I think Victoria's like, why can't I have a phone? Well, if I had to suffer, you had to suffer. That's how it is.
We didn't have cell phones when I was in 8th grade.
What? I don't want to ask how that's true. What?
I didn't have a cell phone until I was probably in my 20s, and it was a flip phone. It was actually you had to pay for the minutes. So you only got so many minutes, and you had to pay more.
Did you have that Razor one, the Motorola?
I did have a Razor. I had a hot pink Razor.
Yeah.
Yep.
I
Mhm.
remember, man, the tech.
Oh
with
yeah.
phones. So, man, all right. So what grade was I in? So it was like 2007, 2008 when most of the kids starting getting phones, but they weren't smartphones yet. High school hit, because middle school is when like the iPhone came out.
Mhm.
High school hit, and almost everyone had a phone already, but not all of them had smartphones. Some did have the iPhones.
Right. The
And-
BlackBerry. You had the Blackberries too, though. That was the first smartphone I had was a
Yeah.
BlackBerry.
Yeah, I remember I bought a BlackBerry from a guy in high school. He gave me a good price too. Now I'm thinking about it. I think it was stolen, all this stuff. Apparently, because he had like iPods. He had iPods and phones, and he would sell them. Like, he sold me the BlackBerry for like $80, and I was like, okay.
Mm.
But now I'm thinking
Sounds sketchy.
yeah. But it was great. That BlackBerry was, it had the keypad.
Yeah.
And then one of the
Now, that's why BlackBerry like went out of business. It's because they wouldn't move to the touchscreen. The guy's like, no, and then Apple did it, and that's why they.
Yeah, because what they did, and because it was, I could go into it. So when a lot of the touchscreens before Apple, if you it wasn't multi-touch. You only could use one finger.
Right.
And then Apple came out and they had their multi-touch. I forgot what the panel's called, but yeah, it was that. And I remember when it came out, and I was like, "There's no way." First of all, I was like, "I can't type on that," because the phone. So the first phone I had was this. It was called Pantech. So it slides like this, and it slid like that. It had a keyboard.
Right.
Yeah, it was so cool. And then the second phone, my mom had it, and she gave it to me. Some LG, same thing. It was touchscreen, but
It was like a flip, like the kickstart,
like a sidekick, right?
Sidekick. There we go.
It was super, it was super, super close. And I was like, I gotta use a keyboard. And then I picked up they were called Windows phones. So it was, back then it was Android, iPhone, and then they had Windows.
Oh.
Yeah, the Windows were actually, it was kind of cool because they looked like a computer. It was kind of cool. It kind of, but it was really, really sleek. But I was like, whoa, it felt awkward because I was so used to a keyboard. And now I got, everything's fine. Then I got that. Then I picked up, I lost the phone, and then I had the phone, and then I actually picked up an iPhone 6S. I think I was using my
It was
sister's.
like the smaller one. Yeah.
Yeah, I had that one because she picked up something else, and I just had to I was looking for a case because it was pink, but I was like, I'll just go with it. And that's when I started using the Apple. I was like, this stuff is cool. And then I picked up a Galaxy and I picked up some of the different Androids. And I was like, oh, snap, this is also cool. So I'm not against Apple. Pick whatever you guys want.
Right.
I like both. I still have an iPad. I think if you're looking for tablets, iPad is just going to kick everyone's butt. Even though
my students, I have so many students, like that's what they take their notes on is iPads.
Yeah.
I mean, because they can write on them and then they can like turn it into, I don't know. I don't even know how to use them.
Have you seen like those, what do they call it? Microsoft Surface? It's like a Microsoft product.
Right.
It's like kind of like tablet, but a computer. So I had one of those because that's when I started taking notes in school. And I thought it was so cool. Like, oh, snap, it's all digital.
Right.
And then my laptop died after a few years. And I was looking for a new one. And I was like, man, it's just so expensive. It's like $700, $800. And I already have a computer at home. And one of the Apple representatives at Best Buy, and I think I spent more money than I made over there. He said, why don't you just get an iPad? I'm like, iPad? But I'm like, no, I need a laptop. He says, you already got a computer. What were you using the Surface, the Microsoft Surface for? And I was like, well, technically just taking notes. He's like, look, come here. Apple Pencil, this and that. Show me the program OneNote.
Yep.
It's like, that's all you need. I was like, let me buy it. And then I got one and it worked perfectly.
Love it.
Yeah. It worked perfectly. And that's what I would recommend some people. If they were really, really on a budget, I would say do not go with a cheap laptop. It will not last. It won't.
Yeah.
Go with the iPad for that price. But then Apple started coming out with their iPad Pros. And look,
because you can attach keyboards to them, right?
Yeah. But
we have students I have students who they have on their desks, they have their laptops.
Yeah.
And their iPads.
Yeah. So
they have both.
Well, and man, so this is the part, man, anyone can do whatever they want. I'm just being very, very honest on my part. An iPad Pro, look, iPads are great, but an iPad Pro, especially for that price, I got checked. I don't know if it was like $800 or especially the big ones, over $1,000. And if you get more gigs, that thing is insane. And that's without a keyboard. That will not replace your laptop. It will not do it. Even though it looks like a laptop, it's still an iPad.
Right.
It will not even like some of the applications. I know some people will try to use like a Premiere or like an engineering one. What's it called? AutoCAD. The things, it will not replace your laptop. It's just the software. It's just, it's not MacBook. It's not using that software. It's using Apple iOS, the same as your phone.
Right.
Which is so weird because technically those iPads with the chip, see, I'm getting all techie with this stuff. It has the capacity to be the same as a laptop, but it's not. It won't. For some reason, Apple will not make it into a laptop because I know what they're doing and it's a business thing. It will be so popular. A lot of people will not buy the MacBooks.
Right.
Or people are like, well, we'll just make the MacBook touchscreen. But no, because they want people to buy everything.
So MacBooks, none of them are touchscreen?
None of them are touchscreen. They had a touch, like right here on the keyboard, they had a touch thing, but they are not touchscreen.
But the screen is not.
Yeah, I had a lot of customers.
They wanted that, I'm sure.
They would go to the MacBooks, checking it, and they'll try touching it. Because every single Windows laptop, almost all of them are touchscreens.
Right.
And
my work one it's touchscreen.
Yeah.
Which I love.
Yeah. And it's a pain with Apple sometimes. But their products are good. But I'm just going to say, when Steve Jobs died, everything did not go that great. Especially, man, dude, it's just, I could complain a lot about it. They make great products, but I look at, okay, what's the price? What's the value? The iPhone, they already came out with the iPhone 16. They just came out with an iPhone 16e. I think it's called E. So it's supposed to be a cheaper one.
And smaller too, right?
Yeah.
Yeah.
Technically, it's actually the same size as the regular one. They had an iPhone 10R and then the SE, which is supposed to be a budget one. So this thing is like $600, which some people are like, that seems fine. But for that price, same thing, like, I don't know, $100 more, you could just get the new iPhone 16.
Right.
But then this is where the trippy thing comes. Let's say $100 more. But then you're like, oh, I only get, let's say 64 gigs. $100 more, I get 128. Oh, snap. But that's the same price as the iPhone Pro, whatever. And you're like, okay, let me get that. Oh, but it's at 64 gigs. Let me get $100 more. Oh, then you're already hitting that point with the Max. And then that's how they kind of get you. It's
I
genius.
think with Apple, either you love it or you don't.
Yeah.
I mean, you have those people who are diehard Apple people, and that's all they have.
Yeah.
I could go either way.
Yeah, I could go either way too. My sister is she is into it, and it's fine. It's her money.
Mm-hmm.
The only problem I have is, man, almost every year she upgrades.
Mm-hmm.
And I'm like, man, that is, I don't know, maybe I'm just cheap. I'm like, man, $1,000 for a phone. I mean, I
think I still have like an Apple. I think I have like iPhone 11.
Yeah, I still have what I'm using right now. So this is a Galaxy S10 Plus, and it came out, I think, almost 5 years ago.
Mm-hmm.
And man, I'm telling you, these Best Buy, my friends are great salesmen. I was going to get the smaller one, and they convinced me to get the bigger one.
Yeah.
But this thing is amazing. It's, well, so far, even though like my sister, she'll complain about the picture, or she said, oh, the quality. No, I mean, look, iPhones, they have great cameras.
Mm-hmm.
The high-end Androids, all of them are great. It's very hard nowadays. I mean, back then with the flip phones, of course the camera was horrible.
Oh, those were awful.
Yeah.
They were horrible.
But that's what you had. But now, technically, the good thing is you could get a phone for like $200 and it's still fine. You could get a $1,500 phone. It's all good. Now they got, have you seen those folding phones?
They have new ones. Yeah.
Yeah. So now I guess the flip phone is kind of back. It's...
Because it used to be the bigger, the better. And now people are, I think, scaling back a little bit, and they're going for kind of a little bit smaller.
Yeah. My phone, I think it's too big.
Yeah.
Now, I know all throughout these years, like it fits in my pocket, but I'm like, I don't know. I'd rather have just a smaller phone.
Mm-hmm.
The only bad thing is I haven't upgraded. I don't think I'll ever upgrade until that thing dies.
Mm-hmm.
So my Galaxy phone, it still has a headphone jack.
Oh.
So, which is kind of cool because I was actually kind of using some of this stuff for it, and it still has an SD memory card.
Wow. Which
a lot of phones do not have.
Right.
That's why I could take my 4K video and I could just move it back and forth.
Mm-hmm.
I need that stuff. I really need it because if I get another phone, I've seen them, like, for example, it could even be the Android phones. More of the higher end ones, they do not have the headphone jack, which I could kind of live without. I use Bluetooth, but they also don't have that memory card. And when I take video, even though I'm still working on it. Yeah. When I take 4K video just right now to get the zooms, it takes up a lot of gigabytes, and it'll eat up like a 256. Sure. So that's my complaints. Yeah.
Well, now even like the new iPhones, they have the new connections.
Yeah.
They have like the USB-C.
Yep. Type C.
So he's like, oh, can I borrow yours? I'm like, yeah. This is from an old one. I'm like, sorry.
Yeah.
You have to have different ones.
So yeah, like man, I'm going to go on a rant right now.
It drives me crazy. Can we just have like one?
Yeah.
And why do we have to keep changing then?
Then
you have to get new stuff.
Because so what they had, let's say, so on Android phones, if people still remember what it looked like, it's called micro USB.
Mm-hmm.
Yeah, you remember
That's what my Bluetooth headphones have that.
Yep.
And
then Apple had that. Remember that?
The big one. Yep, the big fat one.
Yeah, 32 pin. Man, that thing was insane. Then they went to Lightning. Yeah, and that was actually kind of cool. It was really, really cool. And then
and now they went to the.
Yeah, so Android started, man, this was years ago though. We have, I'm going to say like 10, 15 years maybe. They switched to Type C.
Mm-hmm.
Computers have Type C. Almost, yeah.
Stop.
Yeah.
My ThinkPad that's what I have for work. That's a C?
This is a ThinkPad also.
Stop.
Yeah. So technically you could plug in your iPhone
really?
And all that stuff. Yep.
I had no idea.
This is also Type C. So almost everything like mobile has switched to Type C.
I had no idea those are the same ones.
Some of the headphones, if they're not, they're also Type C. So that's why, like, hey, it's a universal connector, like USB. USB is universal.
Right.
It's just the newer version. And also, transfer and everything, fast charging. So Apple, what they should have done before is, hey, let's switch. But they didn't want to because accessories.
Right.
Which makes sense. Yep. How are they going to switch from Lightning to this? Now you got to buy new accessories. But this is the problem. when the iPhone was the first one to take out the headphone jack,
Mm-hmm.
and they started having the
That was
adapter.
huge.
Yeah, they had the adapters, but then they were promoting the AirPods, which is actually kind of cool. You're like,
Mhm.
oh snap, wireless.
Yeah, cool.
And then, but what they did with their MacBooks, I gotta check back, but when they did a redesign of their MacBooks, because before, if people remember, the MacBooks had every connector. They had
Now you don't. Now you have to get.
exactly. So
Now
they
you have to get a dongle.
yeah. So they switched to Type C, which
Yeah.
is good, but they removed everything.
Right.
And why they did that is so they're lying. I know they're lying. I look it up, and everyone says it. Everyone knows. They say, "Oh, it's for faster speeds." Yes, it is, but you took out every connector. Because also, if you look at the Windows laptops, like sometimes your ThinkPad or whatever, there's some that still have everything. Like this has 2 Type Cs.
I think I have HDMI on mine. I have the USB. Yeah, I have it all on mine.
Yeah. Well, that's what they should have done with the MacBook.
Right.
But they didn't because they want to sell adapters.
Yep.
And then on the iPad, when one of the newer the first iPad Pro, I believe, the one without the home button, they took out the Lightning and they switched it to Type C. And a lot of us were like, oh, snap, that's cool. Now they're going to switch to Type C. But no, because then they had the regular iPads with the regular Lightning. And that confuses a lot of customers.
Mhm.
I have to explain. And it's a big mess. And now what happened, why they switched to Type C, Apple, they weren't going to do it. They wouldn't have done it because so many accessories.
Mhm.
The Europe or the EU, they made a requirement saying, hey, you have to use Type C. That's why they switched.
Wow.
So, but that's why they technically, I think they would have done it. Just have, okay, the European version is Type C and then the American version is the Lightning, but it would have been a big old mess.
Right.
And then what also another thing they did was now if you buy an iPhone, it doesn't come with the brick. It comes with the cable. What they said was, oh snap, that's we're not including the brick because it's a lot of e-waste. I'm like, okay. Well, you know what they included? So they include the cable, but the cable. So if you like most of the regular cables, you have a USB connector, right?
Right. Yeah. And who doesn't have a USB brick?
Yeah,
I don't know how many at my house.
But this is the problem. So with Apple, what they are doing right now is they include the cable, or depending which iPhone you get. Maybe it's the top one. If you get the top one, they include a USB Type C, but the Type C is on both connectors.
Right. My husband has that for his iPad Pro.
Yeah.
So we only have, I don't know. So it doesn't come with the brick though.
It doesn't come with the brick, but the iPad probably does.
The iPad Pro, I think, did.
Yeah, the iPhone doesn't. But that means if you are if you had let's say the iPhone 10,
right,
that had the USB-C or whatever, or the USB, whatever. And then you go to the brand new one and they're like, okay, it doesn't come with the brick. Okay, but I have the brick. No, you don't, because the other end has it. So you still have to buy a new one.
Have to buy it.
So it's just, it's so amazing.
Trying to get more money.
But yeah. All right. I need to end this.
Sorry. We got on a tangent there.
Yeah. Let's see whoever. But yeah, I'll end this, but I do want to thank you so much for being on.
Well, thanks for inviting me. I had a good time.
Sweet.